Hi everyone, my name is Adam. Today's presentation is about clinical reasoning and decision making based on professional practice. Okay, clinical reasoning and decision making. What does it mean, clinical reasoning? Clinical reasoning means the process by which clinicians collect information, process the information, come to an understanding of a patient problem or situation, plan and implement interventions, evaluate outcomes, and reflect on and learn from the process. This is clinical reasoning. So when we talk about clinical reasoning, there is certain elements or phases we need to follow as a practitioner. So there are 8 stages of clinical reasoning cycle. The first one is consider the patient. In this stage of the clinical reasoning cycle, the clinicians encounter the person who is the recipient of care and begin to gain an initial impression. So this is the first phase of clinical reasoning. The second one is collect information. During this stage, the clinician begin to collect relevant information about the patient, collecting its patient history. The third one is process information. After we collecting the data, the clinician will process the information. The fourth one is identify problems. The fifth one is establish goals. The sixth phase is take action. And the seventh is evaluate. Number 8 is reflect on the process and new learning, which is experiential learning. So when we came to each phases, the first one is considering the patient, which means it's the first impression. When we meet with a patient, we try to be as good hearing of listening the patient from maybe from bystanders or from family members, as listening properly what the patient histories look like. The second one is collect the cues. Collecting the cues means during this stage a clinician collect relevant information about the patient. It might be the vital signs, it includes that, taking full set of vital signs while taking the history of the patient. The third one is process the information. The data we collected, now we try to process it. Number 5 is identify the problems. It might be 3 or 4 problems. We need to identify the urgent one and prioritizing the problems. After prioritizing the problems, the next step will be establish goals. That's the fourth stage. The fifth stage, the goals in where the clinician prioritize the goals of care depending on the urgency. It's like the goals must be specific, measurable and achievable and realistic and timely goal. The sixth one is taking action. In this stage, the clinician selects the most appropriate course of action, as well as deciding who is the best place to undertake the interventions. So this is clinical decision making, which is the sixth phase. Number 7 is evaluate the outcomes. After taking the action, it might be we might give some medication, or painkiller, or morphine, or fentanyl, or methoxy. After we give this painkiller or medication, we need to evaluate if it work properly, or if there any desirable outcome or not. We need to evaluate. This is the number 7. The last stage is reflect on the process and new learning. Reflecting is very important. By contemplate what the clinician have learned from this process and what the clinician could have done differently. So reflecting is very important, which make us improve if we came across similar case in the future. So we will get enhance our knowledge by reflecting. So this is all about the stage of or phase of clinical reasoning cycle. This is all about the clinical reasoning cycle. So when we came to the clinical decision, clinical decision making is interrelated with the clinical reasoning cycle. So if you follow appropriately all the phases, which helps us to make accurate or it's good clinical decision making. So both are interrelated. Clinical reasoning is an important skill that helps the practitioner to analyze and critically evaluate the information collected to make clinical decision. Clinical reasoning is a complex cognitive process that the practitioner collects patient information, process the information, identify the problem, plan, weigh alternative actions, and implement interventions, evaluate the outcomes, and reflect on and learn from the process. So clinical reasonings helps the practitioner to make more accurate decision and increase the confidence of the practitioner on decision making. So clinical reasoning cycle contain some elements which are we must follow it, like consider the patient situation, collect information, process information, identify problem, establish goal, take action or decision, evaluate the outcome, and reflect on the process and new learning. That is the phase that we look before it. So I believe that clinical reasoning make us following the clinical reasoning cycle make a practitioner very confident on what he or she making decision. So clinical reasoning help us on decision making process. That's all about my presentation. I think from presentation you will got some points, some good benefits or knowledge from this presentation. And before I conclude, the 8 phases are very important phase of clinical reasoning cycle. If you follow all the 8 steps, we will come to a good clinical decision. That's all about my today's presentation. Thank you for listening and watching my video. Thank you very much.